Welcome to Pause for the Truth. We are
Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening and welcome to Pause for the Truth. I am your co host, Jocelyn Turner. Such an exciting topic. I say exciting, but it's a serious topic. But I am just super honored to have this platform to allow our guests from the American Cancer Society to join us this evening and tell us about something that's oh so important for our communities. But before I continue and introduce our guests, I would like to bring in my co-host, Dr. Rogers Kane. How are you doing this evening, Dr. Kane?
I am great. It was very nice weather today. I have nothing smart alecky to say about the weather today. So, so
I
except
know.
that I was just running late, rough day at the office, but it is what it is.
Well, thank you, Dr. Kane. I'm glad you're able to make it. And as I said, this is an exciting evening. I am super honored to have Maureen McGuinn come back. Maureen was on a few months ago. I stalked her after a meeting, and she she answered my email and came on and shared some things about the American Cancer Society, and she brought a guest with her tonight. But first, Maureen, how are you doing this evening?
I'm good, Jocelyn. Thank you. So happy to be here again.
Absolutely. And you know, when we talk about cancer, it's just a very serious topic, but it's also an opportunity for people as they learn from you in the past, Maureen, to hear what the American Cancer Society is doing. And joining you tonight is, and I hope that I don't mess your name up, Atia Wilson. How are you doing this evening?
Good, thank you. And it's Atea.
Atea.
Yes, so where there E is, it
Listen,
sounds like an A.
I always give that disclaimer up front. I hope I don't mess it up with a name like Jocelyn, right? You get it. So thank you both for joining us. I'm going to let you first start off by just telling our audience a little bit about yourselves. And Maureen, I'll start with you.
Okay, sounds good. Thank you, Jocelyn. So I'm Maureen McGuinn. I am Associate Director, Cancer Center Partnerships with the American Cancer Society, based here in Jacksonville, Florida. I've been with the Society for 9 years now, and I focus primarily on partnerships with our local cancer centers. But I cover a territory in Northeast Florida and Southeast Georgia. So I sit on all of the cancer committees. I support the cancer programs. We work on access to care initiatives, prevention, early detection, pretty much everything across the continuum. So this subject is very, very important to me. And Atea.
Thank you. And that's actually how we met. You and I happened to be on I think it was on the Uninsured Task Force Committee or something like that, where you presented some information to the group. So thank you again for joining us. Atea, how about telling our audience a little bit about you?
I am Atea Wilson, and I actually sit in Atlanta, Georgia. I am working with Maureen on the Voices Project, which is why I was able to join today. And I am Senior Director of Community Partnerships, and I work in Florida, Georgia, North Carolina, and South Carolina. And just a quick tidbit is that I actually lived in Jacksonville, Florida for about 4 years, maybe about 15 years ago. And so I am a little familiar with Jacksonville and Duval County.
Well, cool. Well, I'll say welcome back through the atmosphere anyway, since we are here in Florida. So Maureen reached out to me and told me about this exciting project that the American Cancer Society is launching, Voices of Black Women Study. And so, you know, which one of you would like to share with us why you're doing this study and what the study is all about? And both of you can answer. It's not limited to just one of you.
Yeah, no, I'm happy to start and kick us off. And Atea is here to back me up and chime in if I miss anything, Atea. Keep me honest here. I'm going to kind of read a little bit from what I have here to share with you. So, equity in cancer care is really at the forefront of our mission, right? It has been for a long time. And so, excuse me, of course, my fur babies are like trying to take over the
We know
camera
about it.
a cat off here. So sorry. Oh my gosh. They're knocking things down. It's mayhem. So we look at every opportunity to prevent, detect, treat, and survive cancer, right? And when we're talking about equity and disparities, we know that Black women's voices have been underrepresented in a lot of these cohort population studies, right? Including our own CPS-3 studies that have captured a lot of information from African-American participants, but not the things that we really want to know more about, especially when it comes to outcomes, diagnosis, treatment, et cetera, for Black women. So it's really an opportunity for us to kind of look at multi-level drivers, we're calling them, of incidence, mortality, and the resilience of cancer and other health conditions amongst Black women in the United States, right? Mm-hmm. This will help us better understand how to collectively address the issues. And it is the largest cohort study of cancer risk and outcomes amongst Black women in the United States. Excuse me. So it's really important information that we're gathering. It's also information that we've never gathered before in any of our other cohort studies. We're going to be looking at things like childhood. We're going to be looking at things like racism and asking some sensitive questions about how these things impact people's everyday lives, which then ultimately impact a lot of the health outcomes that we see around cancer, right? All of those things kind of tie in together when we're looking at people holistically, right? Did I cover it all, Atea? Did I miss anything there? I think that's kind of the basics of why we launched this study.
Yes, and I'll just add that because Black women are also understudied, like they don't really understand some of the factors, which is why this is really important, is because although we have less diagnosis in many areas of cancer, we're having higher mortality rates. And so it's important to try and figure out why that is. Why do we have less incidences but higher mortality? And so this study is studying 100 Black women who have not had a cancer diagnosis. And so they'll follow them for a few years. And so we can figure out what are some of the factors that put us at risk.
And when you say follow them, are you going to be doing some blood work, just asking questions, looking at what I call this, not just me, but the social determinants of health and things that are going on in their lives that might contribute to their health outcomes?
Yes, the first phase is a questionnaire. So there is an eligibility survey that women will fill out initially. Then there's a follow-up survey that asks several questions that do touch on social drivers of health, but just in terms of also our perceptions of things. I was a part of the pilot because they did a pilot in 2 areas in Atlanta, Georgia, and Hampton Roads, Virginia. And so I was a participant in it. And so it does ask some tough questions in terms of how we perceive things, but then also touch on our reality and where we live and our nutrition and things like that. So it is a broad range of questions that are asked. And so you receive that questionnaire every 6 months. And it does take a little bit of time to answer the questions, but it kind of follows you to follow some of your routines, your habits, and other drivers of health.
How do you guys go about selecting potential participants?
It is open to women who are 25 to 55 who have not had a cancer diagnosis and identify as Black or as a woman. So it is open across the African diaspora. And so we're only offering it in English, but even if English is your second language, you are able to participate as a part of it if you identify as Black.
So do you envision, obviously we use social media for so many things. Are you looking to, for example, African-American physician groups like the Northeast Florida Medical Society, Dr. Kane, for example, who's a family practice physician? Would you seek potential participants rather from the medical society or physicians like Dr. Kane? Are you looking to some sororities? How are you going about identifying participants?
We're casting a wide net. So we're going to do all of the above. And Maureen can share more about the strategy in Florida, but we are going to be working with every group that we can reach out to, and also trying to recruit volunteers to help spread the words in their personal circles. So Maureen, do you want to share a little bit more about the strategy in Florida?
You're muted, Maureen.
Thank you. I am the state lead for Florida. So we just had one of our first meetings today where the entire team came together. And so we're absolutely looking to engage our health system partners, any of our partners in the community, our corporate partners, our volunteers. We have a huge volunteer base here in Duval County through Making Strides Against Breast Cancer and Relay for Life. Our Cowford Ball will be engaged. Everyone in our market and across the state of Florida will be talking about this, promoting it, sharing it with their partners, getting the word out. And so I think you mentioned social media earlier, and we definitely will have some excellent social media content that you can just share that will initially, starting in the beginning of May, that will come from our national leadership. So you'll start seeing posts at cancer.org and then on our main American Cancer Society pages. And then we'll start sharing those down in the markets, and we'll have some more information and collateral coming out in May. And then Jacksonville, I'm happy to say, for the state of Florida, will be the first city to kick off. And we have a goal of recruiting about 3,600 women. And we're very confident that we'll be able to do that. The states represented in the study of.
Oops.
Uh-oh. Did the dogs unplug the computer?
But no, her face would be on, but
American women in the United States.
So Maureen,
sorry if I froze there.
You heard me. I said that the dogs unplug your computer.
No, it's the internet. So sorry about that. I don't know if you heard that of the 20 states, we're able to potentially, we have access to 90% of the African-American women in the United States. So that's, hopefully we can get our 100,000 from this pool of women that we are focusing on for this first round here. And in Duval County, our goal is 3,600. Across the state of Florida, our goal is about 7,600. So It's a big chunk. Yeah.
I know you guys said Ms. Wilson, you said all of the above, but in specific, kind of give me an idea as to how you're going about reaching out to the various organizations that you may be recruiting from.
Each market has a strategic plan that we're working from. And so we are tapping into some of our current partners, which is how we were able to come on today. So thank you. So we're working with some of our current partners, but then we do also have a national strategy. So you mentioned like the Divine Nine. So we're working with our national team, our DEI team, to also try and work with local chapters and kind of do a top-down approach in terms of working with the Divine Nine. We will be working with our communications team to also get out some social media and other messages to help with recruitment. And so it is a strategy, but we are trying to work strategically with some of our existing partners starting there, and then also working with our volunteer base. And then we're also doing recruiting what we're calling Voices Ambassadors. And so we will be training some individuals to go out into the community and also share the message at certain events and churches and other places.
So is there a process by which I know you said you're excluding women that already have been diagnosed with cancer. Are you guys seeking women who may have had a family member, i.e. mom, sister, whomever, with a particular cancer that, breast cancer, for example? Is there a greater emphasis on those women, or are you just taking anybody in the population that's of the African American diaspora that have not been diagnosed with cancer?
As long as they're between 25 and 55, yes. And they have to live in one of the 20 states or Washington, D.C. So that's the other caveat too. They have to live in one of the 20 states or Washington, D.C., be 25 to 55 and not have a diagnosis. So if they have a family member who was diagnosed, then they can still participate as long as they did not have the diagnosis themselves.
And is there a reason, and maybe you said it and I just missed it in Maureen's introduction, but is there a reason why these particular 20 states and the District of Columbia were chosen? Were you looking at the cancer rates of African American women in those markets?
It's because according to the U.S. Census, 90% of Black women live in these
Oh, that's right. You did
21
say that.
areas. Mhm.
Gotcha.
Yes.
So I'm sorry to say I am older than 55. So I can't, thankfully,
Don't be sorry. Be grateful.
I know I am grateful. Unfortunately, I have not had a cancer diagnosis. But how do when you talk about an ambassador, I was like, well, maybe I could be an ambassador since I am too old to be a participant. But the main point I'd like to point out, and we can get back to that, is because of historically and the Tuskegee Project. I know we get tired of beating that drum, but reluctancy in the African American community exists, and we have to know that. And so, how do you envision getting beyond that reluctancy due to the historical nature of the Tuskegee Project, as an example?
With humility. We are aware of some of the hesitancy that's there. In addition to the Tuskegee Project, there have been a number of projects. We know historically Black women's bodies have been taken advantage of and used for various reasons. And so we're very mindful of that. And in some of our messaging, we try and communicate that and answer questions. And we're not giving treatment, nor are we withholding treatment. So it is just a question. It's just a questionnaire to start. And so we're hoping that we can answer some of the questions and get past that hesitancy. So that's the goal, but we are aware of some of the challenges that come with that. And we're trying to address it. And those were some of the lessons that we actually learned through the pilot, is that it does take a little bit of time to get people to move from interest to action in terms of signing up for the study.
I'm a woman, not literally, theoretically, I'm a woman that is maybe interested in your project, but I'm on the fence about what benefit is it going to serve me or people like me. What do you do to convince them to, because I'm used to, when we're doing a lot of studies, sometimes my patients usually come back and ask me, Dr. Kane, what are your thoughts on this study? And so, and I know some of the women, since you guys are looking at a wider choice of whom to select from, i.e. recruit from. Sorry, I should have said. What do you say to those people? If you go into Divine Nine, as you say, you go into one of those organizations, what are you guys going to do to kind of encourage or entice women to participate in this study? And then they may also ask, and I'm trying to play devil's advocate, we also ask, well, what benefit would this be to me? Which is what a lot of patients ask.
Yeah, it's kind of the same as what we talked about previously about clinical trials. It might not benefit you right now. What we're doing this for, it's a longitudinal study. So we're looking, we may get answers 30 years from now that help your loved ones, your family members. They may help you. We don't know, but that's kind of where I go with that. We don't always do these things for ourselves. It's for the greater good, really, is how we're kind of looking at this. And then advocating with those organizations, it's really just explaining what we're doing, why we're doing it, explaining why it's necessary. And we have national partnerships with the Divine Nine, with the links, with a lot of groups that we're currently in the process of kind of, promoting this to, and then hopefully these organizations will then share that information with their chapters. And that's when the chapters that we engage with at the local level will come on board and engage with us around this subject. So I think getting voices from the field sometimes of people that have participated in studies can help. We have a lot of past volunteers, our ambassadors. These are going to be people potentially from some of the organizations that we talked about earlier. These are going to be people who have a connection to a sorority or a fraternity or another civic organization who can say, I'm an ambassador for this study and I believe in this study because, X, Y, Z. And while we might not see the outcomes for this today, your daughter, your granddaughter, your grandchildren, your other family members could benefit from this in the future, because this is information, that might not have been as readily available before, right? So it's really just about access and increasing awareness.
Mhm. Yes, the ultimate goal is to save lives, and because we have been under researched, that this is an opportunity to play our part in that.
Yeah.
I think about the model I was involved in. My background is I worked in public health for many years. Someone said to me the other day, several decades. I was like, oh, don't say it like that. But anyway, and I think about, what brought me out of retirement is COVID-19, working on vaccine hesitancy. And in that, we use what we call trusted messengers, those community health workers, to go out in the community, just regular everyday folks. They may or may not be college educated and connected to an organized group. However, they were the gatekeepers, if you will, into many of the communities. Do you envision during this project that you might use, and I guess that's the kind of the equivalent of the ambassadors that you will select to help you, again, just to really encourage and help people to understand the importance of the study? And did you say how many years or the study is going to be?
Oh, okay, I guess I'll answer that then. So our ambassadors are supposed to be trusted people in the community. So that is the start. And then the communities where we have relationships with the community health workers, we will also work with them to help with some of the messaging. And then in terms of the amount of time, we're going to follow them once they're enrolled. And Maureen, correct me if I'm wrong, but I believe is 20 years that we're going to follow them, and you get 2 surveys a year. So it is long term. And then the second piece is that there is an opportunity for some women who are enrolled in the study to also be requested to do a blood draw, but that is completely voluntary and is only for certain women who follow up. And then they will also follow up with them. I think it's just once a year with that. And so there are some opportunities to have some additional research in addition to some of the social drivers of health. So I did want to mention that, because I don't think that we had mentioned that initially. But the basis of the study starts with the questionnaire.
So as a clinician, what are you looking for? Okay. So far, I got the understanding of blood draw. In addition to, I got the understanding of a questionnaire.
Mm-hmm.
But in addition to the questionnaire, I did hear you say just now blood draw.
Mm-hmm.
1, what are you looking for in the blood draw? And 2, what other additional means of monitoring a patient you guys may be looking at? What other items maybe you be looking at?
That's it. The blood draw is just to see how people's bodies are impacted by some of their social drivers of health. So it will just do the basic blood draw. It's only be for a selected number of women. It won't be for everyone, and it is optional. So just because you sign for the questionnaire doesn't mean you have to go on to do the blood draw. So it's just a way to kind of see where we are, check some of your vitals and your levels, and to see if that impacts it environmentally, if that impacts it, physical activity, nutrition. So it just kind of is a way to see it numerically versus just with the questionnaire.
Are you looking for, when you're looking at the blood draw, you guys may or may not know specific items they're looking for. Looking for cholesterol, looking for kidney function. What exactly are they looking for?
I should know that, but I don't. Sorry.
That's okay. We can, if you get it back to us, we can
always. I have my notes here, but I don't know.
You can always attach it to the.
It's a no judgment zone, Atea.
We can send you a follow up. Yeah, I don't have it either.
When I'm talking to patients, I'm and I want to advocate for a particular study or whatever. I like to tell them exactly what's included, what does it do. And another question then would be, are you publishing any data along the way in that 20 years? Or are we waiting to the very end before you start to publish data?
Maureen?
I believe with our other studies, we do start publishing our findings. I don't know exactly what the initial findings, what we're going to be looking to publish in the beginning, but I believe there will be publications along the way, and we'll be following for 30 years, not 20. So
Okay, sorry. Okay.
I know from our other cohort studies, we do publish our findings in our Cancer Facts and Figures and other journals. So there'll definitely be some things published about it before the 30 years is up.
Yeah, because some of us might not be around in 30 years, Maureen, although we hope to be.
I know.
I think I'm the oldest in the group.
Knock on wood, we hope to be, right? Getting a cancer diagnosis is, it's tough, as you know, for many people. And so one might think that this is a no-brainer, right? There's been cancer in my family, and by the grace of God, I have not gotten a cancer diagnosis myself. And so, I hope that our listeners will understand and appreciate this massive effort that the American Cancer Society is doing. And so if you're just tuning in, our guests from the American Cancer Society are talking about the Voices of Black Women study. It is a 30-year longitudinal study looking at, I say, and I'm not an expert in it. Oh, here you go. I don't have to say it. I can just, but I think about the lifestyle, our lifestyle habits. I also think about, environmental issues, depending upon where we live, knowing that may influence. So my question to our guest is, as kind of a follow-up to Dr. Kane's comment, are you going to publish it? And obviously at this point, you don't know what your findings are. Right. But I'm just thinking if there are some places that you may notice, oh my goodness, there are, I call them those cancer clusters, for example, where there may be some high rates, and you're seeing that along the way in your study. Mm-hmm. Do you envision then bringing some local folks to the table and sharing that and say, hey, did you know? And here are some things that we're finding from the participants in our study that you may want to perhaps look at locally or statewide in terms of some policy changes that may need to occur.
Yeah, I think that's I think you tied it all together so well there, Jocelyn, that like research tied to advocacy, right? That is what we're about. So when we're going in and we're saying, we know for sure that.
Every time she says something, just, it's just right on the tip of her tongue. That darn internet. So while Marlene, there you go, Marlene. It's something profound that you were saying, and then you just froze.
So frustrating. I apologize. So I think you tied it all together so well, connecting the research to the advocacy, because those are two things that the American Cancer Society, we don't just talk about things that we don't know about. We talk about things that are science-based, that we have researched and studied for years. We have both intramural, which is our in-house research department that's running this, and our extramural research, which is the research that we fund. And that so often is that information is what we use when we're going to advocate, when we're going to Tallahassee and saying, hey, we know that we need to get more people covered, insurance coverage in the state of Florida, and here are the numbers, So I would imagine that if something glaring comes up along the way in this study, that ACS absolutely would be at the forefront of advocating for any change that's necessary to make improvements, for sure.
And that would be ACS CAN, since I was a Relay for Life chair in the past.
Yeah.
I know about the American Cancer Society Cancer Advocacy Network.
Yeah.
And I didn't get paid to say that. I just happened to be a volunteer for the American Cancer Society in the past.
I'm cash-apping her right now, everyone.
So it's at this moment that we take a break and don't go anywhere, but we have our History Maker moment where we feature we call a historian in the past. So take a water break, but we'll be to our guests. Don't go anywhere. We'll be right back. Take it away, Tyrone.
Welcome, truth seekers, to Pause for the Truth's History Makers Minute. Today, on April 23, 2024, we delve into a new history maker, Dr. Hadia Nicole Greer. Have you ever wondered about the current state of cancer treatment and the pressing need for innovation? Well, let's introduce you to a trailblazer in the field, Dr. Hadia Nicole Greer. Dr. Green is one of the first African American women to earn a PhD in physics, and only the second African American woman and the fourth African American to receive a PhD in physics from the University of Alabama at Birmingham. With the pride of a former Miss Alabama A&M University, and as a distinguished member of Delta Sigma Theta Sorority Inc., Dr. Green has made her mark not just in academia, but also in community service. Her professional expertise lies at the fascinating intersection of nanotechnology, immunotherapy, and precision medicine. She currently serves as an assistant professor at Morehouse School of Medicine in the Department of Surgery, where her groundbreaking research has been recognized with a $1.1 million grant from the U.S. Department of Veterans Affairs. Dr. Green's list of achievements is impressive, but one stands out. She developed a cancer treatment that uses lasers and nanotechnology to kill cancer in mice in just 15 days after a single 10-minute treatment, with no observable side effects. Recognizing the potential to revolutionize cancer treatment, Dr. Green founded the Aura Lee Smith Cancer Research Foundation. The mission of this nonprofit organization is to change the way cancer is treated and reduce the suffering of cancer patients by providing a treatment that is accessible, affordable, and effective. Dr. Green's innovative approach doesn't stop there. She has developed a 4-in-1 platform for early detection, imaging, targeting, and selective treatment of head and neck cancers. The ultimate goal? To translate these treatments out of the laboratory and into humans, demonstrating efficacy in a variety of cancer models. This endeavor could lead to saving some of the 8.8 million people who die each year from cancer worldwide. So, how can you support this vital work? Visit auralee.org to learn more about Dr. Green's groundbreaking research and find out how you can contribute to the Aura Lee Smith Cancer Research Foundation. You can also follow Dr. Green on social media at Dr. Hadia Green and at Where Aura Lee. Together, we can support the innovation that will change the face of cancer treatment and save millions of lives.
Wow,
My alma mater.
Yeah, I was about to say that Tyrone does a great job, and coincidentally, Dr. Kane is a graduate of Morehouse School of Medicine, so I knew he was going to give that shout out when he heard that. If you're just tuning in, we are pleased to have guests from the American Cancer Society talk about their 30-year longitudinal study, Voices of Black Women. It's something in my lifetime that I've never heard anybody mention. They talked about the 20 states that are going to be included in that. And a fact that I never knew is that 90% of African American women live in those 20 states in the nation. So that's an interesting fact. We have a question. What about income level? Is that factored in? And how will the study ensure participation, including workplace?
Yeah, socioeconomic level will be something that's included in the questionnaire. That's something that hasn't been included in some other questionnaires. And then participation, including workplace. So like looking at like profession and things like that, where we're going to be looking at education level, career, and other socioeconomic factors for sure, food insecurity.
Yeah, I think she might be also referring to where the person worked. Obviously, where they live, we're going to look at it. But yeah, today I have a person that worked in a concrete making factory. Okay, so I'd be highly suspicious for lung cancer in that individual or lung abnormalities. Let me put it that way. And so I think she may also be referencing that. I'm sure she's listening, and if she wants to clarify anything that I just said, she will.
That makes sense then, Dr. Kane. Yeah, so we would definitely be looking at industries. So if, I would imagine if we have a large number of women, as you use the example that say I work in an auto factory, for example, and then we start seeing some linkages, I'm sure, that we would be looking at that as well. Yes.
Go ahead, JT.
No, I was just gonna again really thinking about it. If you're on the fence, as Dr. Kane said, in trying to decide that when they officially launch this campaign, and that's going to be the first week in May, right?
Correct. Yes.
If you our audience doesn't know, May is Women's Health Month, so I think this is a very important time that the study is launched. But you may have, if you're on the fence and thinking about it, if you've ever had any woman any person in your family to be diagnosed with cancer, and maybe they didn't smoke, or there may be some issues that they were, living a high risk life, but simply just because they're Black, simply because they're a woman, simply because of where they work or live, they may have been diagnosed with cancer. I've had a friend, I won't name them, and they said everybody in the last 10 years in their family have died of cancer.
Mm.
And so if you are that type of person and you have that type of history in your family, to me, it's a no-brainer that this is something that you should consider. For those of us who are seasoned, I won't call older than 55, we're not eligible.
Go
We
ahead.
still have a responsibility, in my opinion, to encourage our younger family members to participate, and our circle of influence to participate in this study. Is there anything else about the study that you all want to mention?
Well, let me ask this question before they kind of summarize that part.
Okay.
Let me ask this. So, you guys brought up a key, you, Ms. Turner, as well as Ms. McGuinn, you brought up environmental issues. I'm sure the questionnaires include stuff like exposure to secondhand smoke, like growing up in a household that the parents smoked, or one of the parents smoked. Also, if you guys recall, well, you may not, Ms. Wilson, but Ms. McGuinn, I'm not sure how long you've been in Jacksonville, but I've been here long enough since 85. The old paper mill that was over on the north side.
Yeah.
Proximity with which people live there. Not to mention some of the other environmental toxic grounds that also exist in Jacksonville. Jacksonville is kind of unique to that point because there was quite a few that were not uncovered until exposed.
Right.
So I'm sure you guys may probably asking those questions as well. Correct in the questionnaire.
Yeah. Go ahead, Taya.
I was like, yes, it does ask questions about like where you grew up, how you grew up, about food insecurities. It even asks about abuse. So some of the questions are tough, but it asks a wide range of questions. And then also, just from other studies, we know that like living near a landfill or living near a plant, there are so many factors that go into it. Living near the highway, so there are many things that go into it. So it does ask questions about where you lived, and then some of the factors that were surrounding your community, even ask about violence. So there are lots of questions in there related to your past and your today. So it does do the gamut in terms of going across the spectrum with that.
If the person develops, I enroll in the study. Let's assume I'm a Black woman. I enroll in the study today. 6 months from now, I find out that I have breast cancer. Will I be disenrolled at that time, or will I be continued to be followed? I think I know the answer, but other people may ask that question, so I just want to be sure.
Yes, she will continue as part of the study. So if you receive a diagnosis during the study, you will still stay in the study. So that doesn't disqualify you. There's no disenrollment once you're in.
And is any and all cancers, I want to make sure people also understand that any and all cancers, in terms of you having had cancer, pancreatic cancer would be just as disqualifying as breast cancer, correct?
Yes, there are, and Maureen, keep me honest, there are 2 cancers that are disqualified, but needless to say, when I need the information, I don't have. There's a thing happening here.
So all cancers except for 2 types of skin cancer would disqualify you from being in the study. And the two skin cancers are listed on the flyer, I believe, in the requirements to participate. Maybe on the other one.
Yeah. So
we have some follow-up to do with you. We will get you some information.
So when this kicks off, and I think tell me the date again, is it May 6th?
May
6th, yes.
So
Yeah.
how would people enroll in the study?
So our ambassadors will be out in the community. They can enroll through the study. We'll be sharing communication with a link to a website for them to get registered. And it's just that easy. They can scan the QR code on the flyer to go directly to the site to create a participant login and to get registered. And then we'll be working with all of our community partners to get the word out and to get those ambassadors out in the field. Like you said, that kind of community health worker model, but with a local volunteer going and saying, maybe to their church, to their leadership at work, to their coworkers, speaking at events, speaking, wherever you can promote this. If you're in a cafe and you want to put a flyer up on a bulletin board, we can use all the help that we can get, boots on the ground here in Duval
Hair
County.
salons, I'm thinking of hair and nail salons.
Clinician offices. I'm looking at clinician offices in terms of how are you guys approaching the clinicians in the area? Black, white doesn't, but especially Black clinicians. I have in mind an OBGYN group that is a lot of Black women go there.
Okay.
Will there be a particular? Can we contact you guys and ask you to come and speak to those groups?
Yeah, absolutely.
In particular, or at least bring them some information as it relates to this study.
Absolutely. And ideally, what I would love to do is recruit an ambassador or like a champion in those areas. So any contacts that you have that want to get connected, I'm happy to meet, have coffee, stop by your office. We can get you supplies. We can get you all of the information that you need to get engaged and to get involved. Yeah.
And is there any piece that you may have available so that, for example, I have friends in other states, some of the other states that you mentioned that we could share with throughout and even post on our own personal social media platforms?
Yeah, as soon as those materials go live, before things are kind of embargoed right now, media wise. We've got the flyers, and then as soon as those assets go live, they'll go live on our national accounts, and we'll start sharing them out. So I can tag you on the social media platforms that we're connected on, and then I'll also send you guys an email with more information about how to promote.
I only got one definition of embargo, so what do you mean?
It's on hold right now. We're not. Some things they're waiting to release because there are things I think media wise that we're excited about. We don't want to launch just yet, so we'll launch everything in May. I know you're just messing with us.
In the meantime, though, people can go to voices.cancer.org to get some information. It is available on the website right now, voices.cancer.org.
So May 6th is going to launch when all of those fabulous marketing materials are available and you release it to the community or in, nationwide, if you will, and you reach that 100,000 mark. Then are you going to cut it off, or are you going to consider attrition and continue adding folks to the study?
Well, that's a great question. I don't know if we can continue to add beyond 100,000. If the goal, I would imagine if there's opportunity that we would welcome it. What do you think, Atea?
I think that it would be wise of us to continue to add people. I don't know what the cutoff would be, but I do think that if we get to 100,000, that would be amazing for us to add a few more on top of that, because we need a large enough sample of women to better understand some of the health inequities and to understand disparities and to reduce the cancer mortality rate. So for me, I would say the more the merrier. I don't know if that's what our team will say, but I think the more women we have, the better, because there's just so much we don't understand and don't know. So I think that more women can help us to understand.
My 2 cents of logic would be to continue beyond, because 30 years is a long time. If I participated in that study, I'd probably be dead at year 15 or something. So you kind of want.
That's why old people aren't allowed.
Well, I mean, there are such things as Mack trucks. You walk out in front of a Mack truck and get there. But anyway, my point is that I'm trying to make is that you may have people that drop out for one reason or another, and if you want to maintain like you said, a very high sample of within the study, you want to go on ahead and take in it. If you get more than 100,000, you get 200,000. Great. It's just a better, much better representation of the population.
Yeah.
Mhm.
And if we
And
look at
so-
the numbers to that kind of our goal, the 100,000 of that, Florida will represent about 7% of that number if we hit our goal in Florida too. So that's really interesting to think about. When we look at 20 states, we're taking up almost 7% of that 100,000. So there's going to be some really great information that comes out.
Mhm.
I think that will be very beneficial to our community here.
So are you guys addressing to anything to some of the men? I heard some of the guys, someone say, the guys want to know where all these single women are, all these women, all these women know, 90% of these women in the U.S. are in these states. They want to move to those states. But are you doing anything to address to the spouse or the boyfriend like we do sometimes with women when we want to go after the men with prostate cancer? We address the women to help recruit. So
Yeah.
you guys got any type of literature or a plan or ideology or whatever it may be to talk to Black men to help them get their family members enrolled?
Yeah, well, I mean, Black men are husbands, fathers, brothers, cousins, uncles, physicians, so
Right.
absolutely. The more we can share this information, not just with sororities, we're looking at fraternities, we're looking at male-centered civic organizations as well, the Masons I heard today. So we're working on all of those connections for sure, because we know. Yeah.
Again, this is a very important thing. So when the study starts, so no matter, obviously people are going to join the study, enroll in the study, I should say, at varying points. So the 30-year mark starts at the day you're officially enrolled, not everybody starting at the same time.
Right.
You all have such a great questions.
Really good question.
Listen, I just, I got it like that, I tell you. I spent 36 years in public health. I'm a health educator, so that's my thing.
Well, and I'm so glad because I have been taking notes, and so we're going to get some of these questions answered. But so I don't know the answer to that one, but that is one for us to follow up on because that's a great question, and I'm sure we'll get more questions.
One thing I will provide you guys, maybe that's right, but I will recommend to you guys your efforts, and you may have done it already. I don't know. The Florida State Medical Association, which is the state the state organization that we thrive from, the Northeast Florida Medical Society, Florida State Medical Association, and the National Medical Association. Those are associations that were formed when African Americans were not allowed to join the American Medical Association. So they are large. They represent a large number of Black physicians throughout the nation. So I hope you guys would think about contacting someone within those organizations to let them know of what the study is all about. Many physicians of all sorts are in both of those organizations, whether they're family practice, whether they're pulmonologists, whatever it may be, gynecologists, they are represented within those organizations. And so it would behoove all of us to at least contact them and let them know what your plan are, have someone to be able to talk with them in particular and let them know what you guys are trying to do and why we feel is beneficial to African American women throughout the nation.
Yeah.
Yeah, that's a great idea. And our chief diversity officer, she does have a strategy. And so I've actually written that down to share with her as well, because she is one of the executives that is sponsoring this research. And so I'll be sure to share that with her.
Are you involved or are you partnering with the, some of the local hospital systems? I look at Mayo Hospital or Mayo Clinic, for example, having representation here in Florida, Minnesota, and Arizona. Are you looking at systems like that and or the insurance systems like the Blue, Aetna, or some United Health or whatever to help promote or get the word out about the study?
including MD Anderson, who may be treating cancer patients, but they may have relatives who have not been diagnosed yet with cancer.
Yes,
And
absolutely.
opportunities.
We are partnered with all of those hospital systems, and that is part of my job, is to get the word out to our hospital partners. So it'll be happening, and then that hopefully Dr. Kane will trickle down to some of our primary care practices and our family practices, and we'll cover all of our bases here in this area. So and then also Florida Blue. We are working on engaging with Florida Blue. We don't know at what capacity, but we work with all of the state health plans, all of the health plans in Florida and across the region that we're covering, that 20-state region. We have relationships with the health plans. We have the Department of Health. We have all of the cancer control collaboratives, all of those organizations at the table. And we're just working on how to strategize with them to figure out where the best fit is, where we can, partner and bring that message to everybody.
Well, you may kill two birds with one stone, Doctor. At least locally, Dr. Kelly Tice is she's a former. You may know her. She's a former medical director, not medical director for Duval County Health Department. The director for Duval County Health Department and associate for the Florida State Department of Health. In terms of, you may know her, but she represents, currently she's the president of Northeast Florida Medical Society, which is the organization we're referencing. And she's a VP over at Florida Blue.
Yeah.
So you kill two birds with one stone with that. So you may want to contact her if you don't have her information, whether she's listening or not. I'm going to divulge it to you.
I'm sure. I know we're engaged with their executive leadership for sure. So we have, I have a peer who manages that relationship at the state level.
Okay.
So I would imagine that she is connected to Dr. Tice.
If not, let me know.
I'll make the connection. Yes.
So I have one last question before, as we wrap up the show, something that we have not talked about. Historically, if you have an ounce of Black in you, but both of your parents are not Black, you are represented according to this country as being Black. Are you looking at people who are, or if you are biracial, are you excluded from participating, or are you still eligible if you self-identify as Black, or if the system identifies you as Black?
The study is open to women who self-identify as Black. So if they identify as Black, then they're eligible. And the same thing is true for identifying as a woman. So if there's someone who's transgender, then they also can qualify for to be eligible.
Thank you. Thank you for mentioning that. Well, we're at the last 5 minutes of the show. I hope I didn't overwhelm you with my questions, but obviously this is again, a very important study, and we like to give our guests an opportunity to share anything that we may not have asked you, or just your final thoughts to share with our guests about tonight's topic. And I will start with Atea this time.
Well, I will just say that this is a really important study. As someone who identifies as a Black woman myself, I understand that we are often mistreated and underrepresented, and this is our opportunity to have a say-so in our healthcare moving forward. And so the American Cancer Society has done great research in the past, including they were one of the first to link cigarette smoking to cancer. And so this is another opportunity to have some of those linkages in terms of Black women in our care. So I enrolled myself. It was painless. And so I think it's a good opportunity for people to have a voice who traditionally don't have one. And we understand some of the hesitancy, not just with other clinical trials, but in terms of just survey fatigue. We're receiving surveys for everything. So I just want to stress the importance of it and understand that we recognize that, and we're doing all we can in terms of it being self-paced and having an opportunity to do it where you feel comfortable and to give people the opportunity to join.
One quick question that I want to interject before we get to Maureen, because I did not ask, and I know I'm not the only one who thought about this question. Are participants being compensated, or is this voluntary?
There is no compensation for answering the questionnaire.
Okay. All righty. I thought I'd ask. Thank you, Atea. Maureen, what are your final thoughts?
Final thoughts. So, Voices of Black Women is a historical population study that I feel is very important for people to participate in. It might not benefit you immediately today, but it can benefit future generations to come. And if you're a person who is passionate about health equity and disparities and health outcomes for everyone, then this is something that I highly recommend supporting and promoting. And anything that I can do in our community, anyone that has questions in Florida, please reach out to me. I could, Jocelyn and Dr. Kane have my contact information, and I'm happy to help. Thank you.
Thank you. Dr. Kane, what are your final thoughts?
I want to thank you, ladies, for coming on. We very much appreciate especially all your efforts at trying to close this old slogan, the disparity gap, the health gap that we're seeing, health disparity gap that we see in society that has persisted forever and a day. I would like to encourage ladies to participate as much as they can in looking at this study. I see no harm in participating in it. I can see some harm in not participating in it if we can't get enough information as how best to treat the people that are part of the studies, i.e. in this case, Black women. In other studies, it winds up being whatever the study is all about. Sometimes Black men and prostate cancer and whatever it may be. But I strongly encourage for people to participate in it. I know as I said, I may be dead and gone by the time the information is out. All the information is out. But I will have my 5 girls may benefit from this. And then my grandkids, which are a lot of girls had girls, may benefit from this, and then I can rest in peace in my grave that we did everything we can to make life much more sustainable for them. So thank you, ladies, for coming in. I appreciate it.
Thank you, Maureen and Atea and Dr. Kane. Again, if you're just tuning in and you missed the show, check it out and share it with folks. Participating in the Voices of Black Women study is a very important opportunity, as all of our guests have said, for you to be a part of a study to determine, are there any risk factors associated with you just being a Black woman that may predispose you for a cancer diagnosis? No one wants to have a cancer diagnosis, and how important and special it is that the American Cancer Society, a premier organization here in America, is taking the lead on a very important study like this, quite frankly, that I don't know that has ever taken place in the African American community, specifically for Black women. So on May 6th, look for the nationwide launch in the 20 states that the study will be conducted in. And if you are between 25 and 55, please sign up. And if you're outside of that age range, then encourage your loved ones, as Dr. Kane mentioned, to participate in the study. As it says, your voice is the key to changing lives forever. You can help contribute to the long-term health of African American women, perhaps for your children or your grandchildren and future generations beyond. Thank you again to our guests, Atea and Maureen, and we look forward to having you on again to share updates about the study. Even if there are some things that may have changed, we look forward to you sharing some information that we can add on our website. To our guests, to our viewers, thank you as always for tuning in to Pause for the Truth. Tune in next week. Good evening.
Welcome to Pause for the Truth. We are grateful that you joined us today and hope you've gained valuable insights on our current topic. We look forward to having you with us next time as we explore trending issues in our community and discover ways to simplify life for you and your loved ones. Our dedicated panelists and staff are committed to sharing knowledge and serving our community. But now, we need your support. Please subscribe to our YouTube channel and spread this valuable knowledge to others. Don't forget to invite your family and friends to tune in to our podcast every Tuesday at